Dr. Powell, thanks for joining us. Our topic is ADHD. What is ADHD? What do the letters stand for?
It's Attention Deficit Hyperactivity Disorder. That's what the initials stand for.
How does that compare to what we used to say, ADD? Is it the same?
Well, that's Attention Deficit Disorder, which does exist. You can have attention deficit, hyperactivity, and then you can have mixed.
What does Attention Deficit Hyperactivity Disorder mean?
Well, attention deficit is failure to attain attention for long periods of time, and the hyperactive part is fidgeting or hypermobility of extremities driven by motor type activities.
Okay. Why do there seem to be so many children diagnosed with ADHD? Is this an epidemic?
Well, I think we feel like it's more prevalent because it is recognized and treated more frequently. It's really only about 6 to 8% of the children have it. That's why it's important to get proper evaluation and make sure it's not something else going on, learning disability or some other psychiatric problem.
You know, relative to our experience as grown adults, it seems to be relatively new. It seems to be something we didn't hear of all the time we were growing up. We started hearing about it recently.
Mm-hmm.
Is it a new phenomenon? And if so, where did it come from?
No, it's not new. It was first mentioned in medical literature in 1906, so it's been around. It's just that the treatments are relatively new, but we didn't used to treat high cholesterol either. So, is that new?
Okay. Is there any genetic component to it?
Yes, there is. There's been about 30 studies that have proven genetics do play a role.
Kids are naturally active and they're naturally fidgety. How do you tell? Right.
It's actually you do have to compare age-based. 2-year-old to 2-year-old. You can't compare a 2-year-old to a 15-year-old, but it's relative to their age group, hyperactivity, inability to concentrate, follow through on their activities. So you really don't see a lot of it actually treated till school age.
You say treated. How do we treat it?
There's multiple choices. You can do medications, stimulants, and there's non-stimulants. Behavior therapy, there's parenting classes. You can regulate the environment the child is in.
You said medications, stimulants, and non-stimulants. Let's amplify on that a little bit. Talk about stimulants, what's the difference?
A stimulant would be something like a Ritalin, that type class that if you don't have ADHD, it's going to give you, I guess, extra energy and hype you up a little bit. But if you do have ADHD, you have like kind of the opposite effect where it kind of just smooths things out.
How do the Ritalin, how does it work?
It increases dopamine in the prefrontal cortex. So it enables you to focus, because the front part of your brain is the more higher level of learning and focusing abilities. So,
are there any long-term implications attendant to taking these medications for an extended period of time?
No, actually, they're one of the safest psychiatric drugs out there. Initially, you might have some weight loss and appetite suppression, but that goes away over time.
Do you grow out of ADHD? Do kids grow out of it?
Not necessarily grow out of it. I think people learn how to manage it better, but they say 60% of the people will still have it as adults. But that's probably because the other 40 have found jobs that work with their inattention. They're able to change environments and change situations and not have to maintain constant focus. So they kind of adapt their ADHD to their life.
Are there things other than medications that make ADHD better or worse?
Well, better would include being on a schedule, being rested. There's ADHD coaches that help you use things like timers and schedules and notebooks and filing systems to accommodate. Worse would be off-schedule fatigue, a diet that's maybe unhealthy and too much sugar that would cause sugar levels to rise.
You mentioned diet. How does diet affect ADHD?
Well, I think every kid's going to be different, but they have shown some kids are aggravated by food dyes and sugars. But a balanced diet, especially one in omega-3 fatty acids, has been proven to help. And they do recommend omega-3 fatty acid supplements for people with ADHD.
Give me an example of foods that would be dense in omega-3 fatty acids.
Fish.
Okay.
I think that's why maybe Americans have more trouble, because we have more chicken and meat and not a lot of fish. So you have to make an effort to get omega-3.
Let's talk about ADHD in adults. Is it a factor with adults? Do you deal with it in adults?
Oh yes, there's lots of people that don't even realize they have it till their child's diagnosed, and a lot of people struggle with it and they don't realize the reasons they're having problems balancing the checkbook or getting things done is because they do have attention deficit.
What are some things that an adult might look for in terms of diagnosing himself or herself with ADHD or suspecting it?
Well, forgetting appointments, frequently losing keys, trouble balancing the checkbook, paying attention to details, always having to switch from activities or activities, trouble concentrating.
How do you treat it in adults? The same way with kids, or is it different?
Depends on the severity. Adults can take the same medication as the children. Lots of times adults just need some organizational skills or some ADHD coaching on how to acclimate to the environment and schedule less activities and do things pre-scanned or have the bills automatic paid by the bank, that type thing.
Are there any new treatments being developed for ADHD?
Well, the newest thing on the market is called Intuitive, but it's basically an alpha blocker that's been on the market for a while to help. And then there's Strattera, which is a norepinephrine.
These are both drugs?
They're both drugs to help, but it doesn't do like the stimulants. And then sometimes you can take the antidepressant Wellbutrin will help.
Thank you very much, Doctor.